Hi guys, so carrying on from our previous video on ovarian cysts, we spoke about some simple cysts which do not need surgery. All that your gynecologist will have to do is monitor them through scans, and the frequency depends on the type of cyst. But then again, there are some cysts which will need surgery. So we'll talk about that today. There are some situations where the cyst may be causing symptoms such as pain, bloating, pressure sensation, etc. Or the cyst may continue to grow and may start showing some suspicious features. Those are the situations where you will need surgery. So when do you have pain? There are few occasions when pain can happen. One of them is when the cyst ruptures or bleeds into itself. Basically, every structure in our body has blood supply, and sometimes these blood vessels may start bleeding, and that may cause severe pain, and you may have to be taken for a surgery as an emergency. The other situation is when a woman has what we call torsion, which is nothing but twisting of the cyst. Now, a cyst is quite heavy on the ovary, which is held by a stalk to your body, and when this stalk is not able to bear the weight of the growing cyst, it may twist on itself and the blood supply gets cut off, and that's when you have pain. This again will need surgery. There is one more type of cyst which is called a dermoid cyst. So now, what's a dermoid cyst? Dermoid cysts, they grow from egg cells of the body. So the egg cell, as you know, is capable of forming a baby, and so within the dermoid there are some human elements which can be seen, such as hair, there may be some teeth or bone pieces, or even occasionally the eye. It sounds strange, but it's not uncommon, and these type of cysts will definitely need surgery and be sent to the lab. The endometriotic cysts, which many of you might have heard of, it's becoming a very popular topic now because there is more awareness. That needs another video, so I'm not going ahead with this currently. Last but not least, cancers. Cancers, depending on the stage, will be treated by surgery and say chemotherapy, but that is not the topic for today. So what does the surgery involve? Most often it's a keyhole surgery, which is done as a day case procedure. Of course, you will need general anesthesia, and it is done by placing small incisions, in layman's terms cuts, about a size of 1 centimeter, which is taken into your belly button initially in order to pass the camera to have a look inside your tummy, and there may be a couple of cuts on either side, or depending on the position of the cyst, the surgeon will decide where to give the cut, and the cyst is removed and the closure is done. So as I said, many times most of you may go home the same day. Occasionally you may have to stay overnight. The recovery is very quick for this, and you will be back on your feet and at work within a week or two. That's about the basics of surgery. Of course, it's hard to talk everything about the surgery in this video. I'll be making a video on it in the future. Please watch out for that. Till then, thank you.